Hi, I'm Steve Adubato, another important remote program. Listen, we're talking all about this vaccine situation. We're taping on the 2nd of February. Things are changing quickly, but no matter where you look, the operation in Essex County, New Jersey, my home county, is really being run very well, and that's not by accident. The county executive of Essex County, Joe DiVincenzo, joins us, along with Maya Lordo, who's the health officer of Essex County as well. Maya and Joe, thank you so much for joining us.
Thank you, Steve. Thanks for having us.
You got it. Joe, listen, things are moving quickly. And so this will be aired after, next couple of weeks. So let's not deal with this moment. But here's the question. How many vaccines could Essex County, New Jersey, the government, administer on a daily basis if the supply were there, Joe?
25,000 a week. 25,000 a week.
Is that 7 days a week, Joe? 5 days a week?
That's at 6 days a week. All right. If we want to, we could actually go 30,000 and go 7 days a week. Listen, if the supply is there, we're going to make sure whatever it takes to get everybody vaccinated, no matter how much time it takes, we're going to get it done quickly.
Joe, it's not about pointing fingers or blaming. It's trying to understand. For the average person, whether in Essex, but they say they're in another county right now, is every county in New Jersey, all 21 counties, do they have their own operation, or is it ultimately the state waiting for the feds and then whoever on the local government handles? I know it's a complicated question, but is every county handling it the way Essex is?
Well, Maya could talk about that, but people ask me that all the time. You know, here in Essex County, we had no choice. We had to start right away. So we started this in October, and we were very, very much prepared. Why? Because reference to our positive cases, we have over 60,000 cases. We lead the state in deaths. Our unemployment is high. Another problem we have is with foreclosures. The other thing was insecurity of food. So we have to get people vaccinated. We got to get kids back to school, and we got to get people back to work. And as far as the other counties, I'm sure they're getting ready, and they're moving forward and doing the right thing.
So again, you'll see on the screen, February 2nd, we're taping this. This is part of our Vaccine Awareness, What You Need to Know series. We're doing it on every one of our platforms. Maya, let me ask you this. Specifically in Essex County, the minority population, my understanding is nationally and statewide, what is it? Just a few percentage of all the vaccines that have been administered are for African-American and Latino Americans. In Essex County, how challenging is that situation, Maya? A, and B, what are we doing about it?
Thank you, Steve. So I think one of the biggest things is we've all been so busy planning and getting this rollout going that our next step needs to be an educational piece. And I have to say thank you to the county executive for really spearheading that, because we have met with the clergy here in Essex County. We have been speaking with the mayors, and also our local health officers have also been part of trying to integrate their community members. But I think our next steps are really coming together as a community and really getting that public health piece out, getting exact information about the vaccine, some of the frequently asked questions that are kind of in people's heads that aren't always being answered. And I think one of the biggest things is there is so much information that is out there, and it's getting given to people from all different directions. I think the next step from us as a county is to kind of go ahead and get a nice, good message together and clear that everyone should go ahead and get that vaccine to save the lives of each other and their family members and community.
Let's do this, team. Hopefully the Essex County website has been up the entire time, and if it's not, we'll put it up in post-production. Joe, let me ask you this. If someone was on the county website, I know we get into the weeds here, but if you go on the county website and you go on the state website, is the information consistent, County Executive DiVincenzo, in terms of how you register? Meaning if someone watching goes, well, I went on the state, I can't get there, should I go on the county? Where should people go, Joe? Is it both sites?
Listen, it's their choice, first of all. They can go on the state website, but people that live in Essex County, of course, I would like to see them go on the Essex County website. As far as what's on the website, it's very easy, but we're constantly, every night we have a conference call with my team, and every day we're changing it to try to make it easier and easier for the public and stuff. You know, it's work in progress here.
You know, Joe, it's interesting. We're going to do a separate conversation with you as part of our Lessons in Leadership series, because for those who don't know, before Joe was the county executive, before he was a freeholder, Joe was a quarterback, not only in college, you didn't expect me to bring that up, Joe, but also played a little ball beyond that as well. Joe, being a quarterback / leader of this, how much of this comes down to leadership and logistics?
Well, listen to me. I was well trained by your father, Steve Adubato Sr. He was a mentor of mine. I was with him for over 40 years, and I've learned so much with him and how to get things done. And what I did is take it from the local level to the county level. And the big thing is staying on top of it. And it's not about yourself, it's about a team. And that's what I assembled here in Essex County. I assembled a great team for the last 18 years as far as providing services. And this vaccination that we're doing right now, it's probably one of the toughest things I ever had to do, because this is about life and death. People have been waiting for this for a while. We want to make sure that they're able to go back to their lives.
Yeah. Maya, let me ask you a health question. The variants that are getting so much coverage, and again, taping on the 2nd, we're going to find out there are more cases, et cetera, of the variant. So the Moderna vaccine is 2 shots. The Pfizer vaccine, 2 shots. Johnson & Johnson, as we are doing this right now, not signed off on yet. The variants, does that mean there's a, quote, booster involved? I don't want to complicate things, Maya, but is there a booster involved as well?
So currently, right now, Moderna is working on, so there's 2 variants that we're going to talk about. We have the UK variant, we have the African variant, and the Brazilian variant, which are similar to one another. Moderna right now is working on the UK variant. It seems that all the research that I've been reading, the current Moderna vaccine is pretty good and well established. But again, this is brand new. We do not have enough individuals that are kind of involved in these studies and also being followed. So we don't know exactly. So as far as the boosters are concerned, Moderna is working on it. Pfizer has not come out with anything as of yet. And currently, as you stated, at this point, the J&J vaccine, the single dose, is pretty okay with the UK variant, as they state themselves. But again, there's just not enough individuals that they can go ahead and determine that.
Thank you. My last question, Joe. And by the way, check out Joe and our Lessons in Leadership program. We'll do a program that I do in cooperation with my colleague and co-anchor, Mary Gamba, a separate conversation with the county executive on leadership. But Joe, final question. How would you describe the, quote, coordination between Essex County, the state, the federal government, and as well as hospital systems in our region?
Listen to me, as far as the state, Governor Murphy and their health commissioner, Judy Percelli, been so good to us here in Essex County. They helped us each and every day, anytime we run into a problem. As far as the federal government, we're not dealing with them directly. They're dealing directly with the state, and then the state deals with us locally. As far as Essex County, we have all the hospitals that are in Essex County involved and engaged. RWJ Barnabas is very big supporter of ours.
University as well?
The University, UMDNJ, Beth Israel, Clara Mas. You know, we're trying to engage everyone. Besides that, we also have colleges that have been involved: Montclair State, Seton Hall, Essex County College, Community College. Everybody's been supportive. But why we're so successful is because the amount of volunteers that we have that want to volunteer and participate in this program. You know, they want to be part of the history. They feel good about going out and helping us. And we couldn't do this without the volunteers. They are doing an outstanding job, and I'm so much appreciative. And I know our county residents are too.
And finally, let me just say that I've seen it firsthand. It's exceptional, not only the level of coordination, but also the level of volunteerism, because you ask folks there and they come from a lot of different places. So to the county executive, Joe DiVincenzo, and to Maya Lordo, the health officer in Essex County, thank you for everything you're doing, and our fingers crossed that more vaccines become available. Thank you, Joe. Thank you, Maya.
Thank you.
I'm Steve Adubato. Stay with us. Vaccine awareness. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by RWJ Barnabas Health, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, NJM Insurance Group, the North Ward Center, Delta Dental of New Jersey, Investors Bank, NJ Best, and by Fedway Associates, Inc. Promotional support provided by bestofnj.com and by The New Jersey Business and Industry Association.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.